So a lot of people have headaches. Headaches are very common in not only athletes but just everyday people. And the types and causes of headaches really vary. However, what we're going to be talking about today is tension type headaches, which have some characteristic spots, specifically some tightness behind and the back of the head that can be alleviated with some self-myofascial releases. Like I said, this type of self-myofascial release, or SMR, can help with tension type headaches and maybe some other types of headaches, especially if you're not too familiar with what type of headache you have. But remember, there are a lot of causes of headaches. It could be a migraine with aura or some sort of vision with it. Could also be simply vertigo or even associated with something that you smell. So keep in mind that there are many different causes and types of headaches, but this is just one simple trick to really help those that have pain and tightness in the back of the head here. But the good thing about the self-myofascial releases, if you give it a try, if it helps, awesome, you found a new trick for your toolbox. If it doesn't help, okay, maybe this isn't the type of headache you have and this isn't most appropriate for you. Nonetheless, it's not likely to make you worse at all. So what you're going to be needing here, you can use a few different devices. This one is just a peanut, 2 tennis balls taped together. Very fancy. You can also just put 2 tennis balls in a tube sock and then just fold up the sock so it stays nice and stable. Or you just have a baseball here that's a little bit more firm. So where we're going to be going here, you're going to find the bump in your back of your head. Okay, so you just find your nuchal line, and most people have a pretty big, prominent bump in the back of the head. What we're working on here is these small muscles, just called the suboccipitals. Okay, there's a big group of them that just roll right underneath the base of the skull. So you find that bump, and we're just trying to go right underneath there. If I'm using the tennis ball, I'm just going to be lying with that ball, with the center of the double tennis ball right on that bump. So the center goes on that bump and we're going just up and down in that region. Okay, if we're going with the baseball, we find that bump and we just go a step to the side there and then we're pressing on the ball. Okay, so what we're going to be doing, we're just going to be on our backs here. We'll start with the tennis ball, the taped up one. Find that big bump, that nuchal line, and then all I'm doing is tucking my chin, pressing it into the tennis balls. Then I can just roll ever so slightly, trying to find those areas that are tender. Once you find that area that's most tender, you just sit there and relax. Okay, you can roll around a little bit, but once you find that spot, really apply that pressure by tucking that chin and wait for that tension in the muscle to relax. Okay, if we need to be a little bit more aggressive or have more specific spots, we grab a little firmer device, baseball, lacrosse ball. You can think of all kinds of things, I'm sure. You're going to find that nuchal bump again and just go right to the side there. Ooh, that's definitely a little bit more tender here. And you just sit there and relax. Okay, I usually recommend 1 to 3 minutes here, but you kind of find that spot and it's really individual how long you need to be there. But sit there, relax, go to your happy place, and wait for that tension to release in that muscle. Okay, you can also, if you're doing the one ball at a time, can work the other side here. Once again, finding that spot, sitting and relaxing. So once again, this is just an SMR to the suboccipitals, and this is a great way to alleviate tension type headaches, especially if you're having headaches in the back of the head. This is our core video.